Opposition? Yeah, come on up. Yeah, sure. Come on up. We can make room for the opposition.
Come up there.
There's more chairs over here.
Good afternoon. My name is Scott Aker, and I'm responsible for quality at Prolecta Bioscience, a California company that produces the only human milk-based fortifier exclusively for severely preterm infants in the neonatal intensive care unit. Let me reiterate, we only provide products for the 40,000 most vulnerable infants born each year. I want to thank the bill's author for amending the bill and opening a dialogue that we believe could result in meaningful improvements in milk banking standards. However, if the goal of this bill is to prevent exploitation of moms by bad actors, it does not achieve its goal. What this bill does do is penalize the good guys, and that's us. This bill will move milk from a safe practice to a less safe practice. Donors with excess milk in the first 90 days postpartum will either sell their milk outside of the state of California, they will sell their milk online, which is a growing practice, or in some cases, they may choose to dump their milk right down the drain. Of the estimated 57,000 moms with excess milk in California in 2015, Prolecta procured milk from 226. That's 0.4% of those donors. Clearly, there's plenty of milk for all needy babies, but not if donors are disincentivized to donate. If donors choose to take their milk outside of California, preterm infants will suffer due to a lack of access to a 100% human milk-based diet. I thank the committee for their attention to this issue, and we look forward to working with the Department of Health to use evidence-based practices to improve standards of donor milk provided to all of our most fragile babies. Because we believe the blanket prohibition on collection prior to 90 days is wrong, we ask that you vote no on this bill today. Thank you.
Good afternoon. My name is Diana Nordine. I'm a Prolecta donor, and I have 3 small children of my own, and I teach middle school. As of today, I've donated and sold over 5,000 ounces of excess breast milk to countless other infants through milk sharing sites, private classified listings, friends, as well as Prolecta Bioscience. While it's true I have an oversupply of milk, ensuring a long-term surplus takes unyielding commitment. Any woman who is willing to subject herself to all this is a person who deserves to be trusted to make healthy decisions for herself and her baby. Excuse me.
Where's the baby?
For 43 months now, so that babies in need can receive breast milk instead of formula, I have sacrificed approximately an hour of sleep and pumped 2 to 5 times daily to keep my milk in good supply. I shoulder this responsibility so that when 2 of my friends couldn't meet their own baby's demand, I could bridge that gap. Mothers can choose to continue using breast milk because of my commitment and sacrifices around the clock to breastfeeding. You can't tell me a woman doesn't warrant payment for this type of work. A man can donate sperm and be fairly compensated without anyone questioning his ability to make a well-informed decision, stripping him of the term donor, or imposing a moratorium on future donations after fathering a child. To suggest an underprivileged woman will make these commitments day in and day out, sell her own breast milk to someone else's baby for about $1 an ounce, and then give her own baby formula purchased with public assistance is pretty far-fetched. I believe I have more than earned every penny for which this surplus of milk has sold. It has repaired the leaky roof over my children's heads and paid for new tires on the car that drives them to doctor's appointments. It is by no means a windfall. But in this way, I can further support my family while making sure my own baby's supply of breast milk will not diminish. To suggest women need legislation dictating how they use their own bodily fluids is both offensive and ludicrous. Thank you.
Thank you. Anyone else in opposition?
Right here, please. Chairman Hernandez, Vice Chair Nguyen, members of the Health Committee, I am here today to voice my strong opposition to Senate Bill 1316. I've been a practicing neonatologist and pediatrician in California for over 25 years. In addition, I serve as medical director for the National Coalition for Infant Health. I want to make my message very clear. As currently drafted, 1316 fails to protect low-income mothers and will have detrimental effects on premature infants in the state of California and, in fact, throughout the nation. The adoption of this bill in its current form would reduce the supply of human milk donations and the production of critical breast milk supplements for premature babies. This supplement, a 100% human milk-derived fortifier, is made by only one company. Restricting this company's ability to collect human milk from its donors nationally, which is exactly what Himbana aims to do through this legislation, will deprive premature babies in California and across the country of life-saving nutritional supplements. The criteria for donation in 1316, including the 6 or now perhaps 3 months postpartum collection prohibition, is not evidence-based. This bill was not requested by pediatricians or neonatologists, nor were they, nor the world's experts in human milk and breastfeeding, consulted as this bill was constructed. For clarity, the American Academy of Pediatrics recommends an exclusive human breast milk diet for all babies until 6 months. This is something we are all interested in accomplishing. The guidelines, however, at no point recommend a mother not donate her excess milk to a human milk bank for compensation or, for that matter, otherwise. The bill has been characterized as bringing health equity to the forefront. That characterization is false. The legislation would actually disproportionately harm African-American babies who are more frequently born premature. To better understand this dynamic, and it's important that we do, I requested information from Prolacta. Although less than 3% of Prolacta's human milk donors are African-American, African-American babies comprise at least 3 to 4 times that percentage of babies receiving Prolacta's products. The company neither targets nor prioritizes any population in their milk collection, but their fortifiers benefit babies from all racial and socioeconomic backgrounds. This bill would harm a population most at risk for disparity. Safety is another critical consideration. Although breast milk is not yet regulated by the FDA in the same way as a biologic or pharmaceutical product, there are inherent risks in using any human-based product if appropriate screening procedures are not followed. Those additional safety measures that for-profit companies have adopted are above and beyond other regulatory guidance. Their vigilance in bringing blood and plasma-level quality control to the breast milk industry has been praised by the Food and Drug Administration and praised by hospitals throughout California and, in fact, nationwide. This bill, however, would not require a breast milk bank, nor nonprofit or for-profit, to follow any safety regulations developed by the Department of Health if they do not financially compensate their donors. This invites exploitation by unscrupulous, bad actors in a rapidly emerging field. Finally, the distinction of profit versus nonprofit does not mean no cost. Nonprofit and for-profit suppliers both sell the milk they produce to hospitals across the nation. Both are in fact important and valuable sources that ensure access to a vital nutrition for the at-risk patient population. But when it comes down to the final analysis, breast milk alone is not sufficient to provide for adequate weight gain and prevent necrotizing enterocolitis or NEC in premature infants. Premature babies need breast milk and a breast milk supplementation to grow. However, the way Himbana has pushed this legislation and the way they are trying to cut off access to the only exclusively human milk-based human milk fortifier in some ways makes me wonder, why are they pushing a strategy that would unequivocally increase the usage of a cow's milk-based fortifier in preterm babies if the Joint Commission goal is exclusive human milk diet? Thank you for your time and attention to this critical issue. I want to finish by reiterating that the impacts from an uninformed approach could have dramatic consequences for the most fragile of patients, consequences that will not be seen until it is too late. Thank you very much.
Thank you. Any other individuals that are in opposition? Seeing none. Any questions from, yes, Senator Mitchell?
Thank you. First, I want to thank Senator Wolk for spending the time to come talk to me about this bill and bringing in folks to come talk about it. And I almost feel like the arguments that we've heard today in support and in opposition have even have unnecessarily further complicated the bill than was necessary, and I'm not sure why that happened. So a couple of comment and then clarifying question. I think the science, without question, is clear that babies fare better when breastfed, and mothers are encouraged to breastfeed as long as possible. We should also be clear about the realities of breastfeeding and why many women stop at 4 weeks is because they go back to work. And the vast majority of our workplaces aren't conducive to breastfeeding or giving, workers on an hourly wage at fast food or IHSS workers the time and opportunity to pump and do all that. So women stop because they got to go back to work. I think that's important. I also have to say that I don't support the notion that Black women's history with wet nursing equates to this notion of being empowered to sell your breast milk as opposed to having it taken from you against your will. I don't draw that correlation myself historically. And so that's why I say, for me, some of the proponents and opponents' arguments, none necessarily complicated this issue. So I want to make sure I'm clear in terms of what the bill actually does versus kind of the swirl around, I think, the deeper political issue. I also, around the swirl, believe that all women, regardless of your socioeconomic status or ethnic background, are clear enough and committed enough to their infants to do all that's within their power that's to make the life outcome best for their infants. And so we shouldn't make assumptions if a poor woman chooses to sell her milk that she would compromise the baby's health by selling her milk before the baby is ready to be weaned off. All of that aside, I want to make sure I understand the difference between the for-profit and the non-for-profit kind of separation. So the for-profit entity, correct me if I'm wrong, Senator, is the only entity that uses the sold or donated breast milk to create the compound that babies in the NICU units need. So that's not the business that the nonprofits are in, correct?
Right.
So we're talking about kind of two separate needs and uses. The nonprofit banks are for adoptive mothers like myself, for example, or whatever the case is, you're not producing enough, whatever. The other utilization is to create this compound needed for medically fragile infants.
Correct. That's correct.
And this bill, with your amendments, because I'm not sure if some of the amendments I'm reading now remove some of the opposition or not. This bill says the limit is now 90 days versus 180. And what else?
And both nonprofit, which already do, and for-profit who do business in California have to comply with the Humana guidelines,
The safety guidelines to guarantee the safety and integrity of the product.
which Prolacta already exceed. So
Got it.
that's not the issue.
So what is the nature of the continued opposition? The 90 days? You don't want the delay at all?
You cannot pay
Well, I think
For
you-
90 days?
for the first 90 days to incentivize breastfeeding.
I think you said it, in fact, adequately. A lot of women go back to work after 4 weeks, and this sort of incentive can help keep a mom home to breastfeed her baby. So if you restrict it to 90 days, then there's a 2-month gap.
Okay, I don't know that I buy that. Okay. But do any of the amendments that she's taken, they don't alleviate any of your opposition? Reduction from 180 to 90 doesn't?
No, the reduction from 180 to 90 doesn't really address the opposition we have, which is if there is a benefit to having a 90-day prohibition, and that's good for babies, then it should be good for babies across the board. In other words, all milk banks should adhere to the same prohibition.
Got you.
There should be parity between whether the donors are remunerated or non-remunerated.
Okay.
I think that in my position, the 90 days stands that, because the nonprofit milk banks, we cannot remunerate donors for their milk. It makes it
Incentive.
correct. And because that we do what we do with no incentive, there's a specific reason for that. There's a long history in the U.S. of problems with that. But also that because our population in California that uses donor milk just the way it's processed versus their product, you know, Scott knows that their product is used specifically, and they're very unique product. I agree, it's very unique and very human-based, and research is beginning to show that human milk is better than maybe other sources of fortifiers out there. The issue is this. The issue is the ability of us to service all the families and the children in California with the milk, the increased need. It is not just for the preterm infants that his product serves.
But he said that he served 200?
Yeah, so-
200 donors.
In 2015, we used, if you assume about 57,000 moms in California that have excess milk, 0.4% or 0.4% of those donors, 226 is what we needed in California to support our production.
And your concern is that will impact your donation level?
It has in the last, I mean, I'm not suggesting that that is just Prolacta's issue, but in California, I can tell you by the statistics that we collect, that the amount of milk we've been able to provide for the hospitals and the families that need it in California is becoming more difficult.
And you're drawing the direct correlation to that versus some other reason?
Well, again, this is only the tip.
Can I speak to something? You said about the breast milk being, for the first month, a lot of moms quit, and there's a challenge of going back to work. As a lactation consultant, you have to understand that in the first month of breastfeeding, that's where the milk supply is established. So what you do in the first month dictates how long you're able to nurse. If you have to go back to work at 4 to 6 weeks or 8 weeks, you may have stored up extra milk to keep your baby breastfed as much breast milk as possible. If they're incentivizing and saying, okay, give us your milk, sell your milk, but I need to keep my baby, especially as an African-American woman, I have higher rates of health disparities, asthma, allergies, diabetes, obesity, all of this. My baby needs breast milk longer just because of that high rate of health disparities. So that milk that I should be saving to give my baby as long as I can, if I choose to not, because I'm not knowing about it, I sell it, now I give my baby formula at 6 or 8 weeks, and now my baby has asthma or allergies or what have you because I didn't have the correct education in order to say, no, I'm gonna keep my milk. So that 90 days gives the mom enough time to build her milk supply, to get the education that she needs, to understand what's going on, and also for her to get support services to establish and maintain her milk supply while she is back at work or school or separated from her infant in any other way.
Thank you for that clarification. One more question, if I may, Mr. Chair.
And let's do
We're
this.
talking about the incentive.
But let's do this. Rather than speaking only if the member asks the question, otherwise I'd ask that you not respond unless the member asks the question. Otherwise, we're just going to have a dialogue and a discussion.
I
Anyway, yes.
apologize, because I did give them the impression that I was nodding and looking, so forgive me. One final question, Mr. Chair, if I may.
Yes.
We talk about this incentive. What's the incentive? How much is it?
Typical incentive would be $1 per ounce donated.
And that's enough, in your opinion, to make someone decide to sell versus not?
You know, for some women, yes, it is. I mean, I could tell you as a donor 30 years ago to the Mother's Milk Bank, I donated 300 ounces. That's $300, which is not much, but the impact of my 300 ounces that went to the babies that needed it 30 years ago was tremendous. It was more than $300, but you know, it's $1 an ounce. I don't know what the other entities that do the same thing. I don't think Prolacta is the only one, and that's the impact of this bill.
Thank you very much, appreciate it.
Thank you. I believe Senator Nguyen had a question.
I do. Now I'm really confused. I'm going to make a couple comments, and then I'll ask some questions to Madam Senator. Madam Senator, I think this is a great, this is a trend where we need to look at. I actually stopped feeding my baby. He's 3 years old, so about when he was about about 12 months or 13 months. And I don't think, the comments I heard earlier that, I don't think breast milk in any way, it's the best thing for, I'm sorry, let me step back. Breast milk is the best thing for all babies, in my opinion. I've learned that. I made sure both of my boys were breastfed. Now, I don't think that regardless of your ethnicity or your socioeconomic background, breastfeeding has been told to mothers, recent mothers like myself, is that it's best because of the antibiotics. It helps the baby with all the immune system from the mom directly to the baby. One thing, though, is, what hasn't been talked about is also, though, if those moms are drinking or doing drugs as well, it does go into the breast milk as well. And so, I think when it comes to, whether you sell your breast milk or donate your breast milk, I think there needs to be a strict evaluation of these breast milk before it goes to another baby, because that baby or that new mother or the other mother would not know where this breast milk comes from and whether it included any kind of substance that should not be on a baby, an infant. And so I'm a big proponent of breastfeeding, and I don't think that most mothers stop after 4 weeks, not just because of job. My concern, Madam Senator, is the 90 days. I believe that within the 90 days is when actually a lot of production happens within the body. And quite frankly, that's where the excessive milk comes from as well, way more than your baby even need. And so the restriction of the 90 days concerns me, and I do appreciate your amendment to 180 days. But if your restriction for the 90 days, sorry.
It's the reverse.
I'm sorry, from 180 to the 90, and I appreciate that. Now, the 90 days, does that restrict nonprofit and for-profit, or is just for-profit?
For-profit
Okay.
and nonprofit.
And nonprofit?
I believe the bill is really restrictive for the 90 days for incentivizing. So if the 90 days,
To purchase it.
to purchase it.
Then,
So it's only,
so it is aimed toward the for-profit,
Well, essentially, the
they're
for-profit.
the ones who purchase.
purchase it.
And the 90 comes from, again, 180 is what is suggested by the American Academy of Pediatrics. But in conversations with the chair and with other members, we thought that 90 was reasonable, particularly since, at least a good start, particularly since another company, another for-profit company outside of the state in Oregon, has a 90-day rule. So I thought that if that was a reasonable compromise.
So I thank you, and I also hear that, a comment was made from the witness that some mothers tend to not know and gives away the milk and should have to be kept because there's an incentive, $1 an ounce. I think on average, most mother, if I remember one, I think I had, I don't know, I had quite a bit, that's too much information. But I think, because I actually, at the time, I was traveling to Sacramento, and I was at the airport in the bathroom every time I'm at the airport, going and going home. So I remember very clearly because I was very committed to making sure that I do it for the 12 months. But I don't believe that there's, I don't know, what is the average that a mother can produce a day, and what does a baby actually need? So I'm trying to understand the 90 days restriction, and what would that be? Can I ask the
Dr. Goldstein.
I think the best way to answer that is that most mothers can adequately provide enough breast milk for twin babies. So the essence of it is that at a minimum, double what one baby needs.
That's only if the milk supply is established appropriately. Sorry.
Thank you.
Sorry. I apologize.
Is there a prohibition on nonprofits from accepting milk from mothers with children less than 90 days now?
No.
No, not according to the bill.
Not at all, okay. I guess my last is, I still don't see, if they can only do, or take 269, I believe, mothers' milk out of 57,000 last year, I don't know how that would restrict, I mean, I think that would hurt. I'd rather have more milk supplies out there that can be fed to all, whether it's for-profit or nonprofit. I don't know if even for the nonprofit, if you could even supply all those milk. You know, because I hate to see any baby, especially premature babies who end up being born at 3 months, 4 months, I mean, you know, whenever that is in a very in dire need of those nutrition. I fear that this bill would, by accident, the unintended consequences, 1 or 2 of those babies might not be able to get the supplies they need unless a nonprofit said that, don't worry, Senator, we'll take care of those babies.
I believe Senator Pan had a question or comment.
Thank you, Mr. Chair. In many ways, I think this bill is trying to address not just the current situation, but what may evolve. And I think we need to pay attention to that. And I would make note that the supporters of the bill are not only the breast milk banks, but the American Academy of Pediatrics, American College of Obstetrics and Gynecology, WIC Association, I mean, many other groups that have been on the front lines of trying to encourage lactation and trying to promote breastfeeding. I'd also make note, as someone who's used to serve on the board of a blood bank, that it's always been fraught with peril whenever we actually pay for essentially human tissue. I mean, that's what we're talking about. And that's always raised ethical issues. We do pay for example, people to give plasma. And you know, we can talk about, and so what parts of the body can you sell? And, you know, someone brought up semen donation and people get paid for that. And we can talk about eggs and some other things. We definitely don't, we ban, I think, payment for blood. We ban payment for organs. Even though we have a shortage of organs, we can sometimes increase our blood supply, but there are reasons for doing that. And I think, and I think and we put those constraints not because we think that people who are donating them are always going, you know, aren't trying to do a good thing at times, but there are also circumstances where people may be coerced into doing things that may end up harming either themselves or, let's say, their baby, someone who's very close to them, and I think that's a concern. So I did have a few questions. So first of all, for you mentioned you have that you're, when you said 226 donors, is that the total demand, or is that how many donors you currently have? Or
that was the total number of donors in the state of California in 2015 that we procured milk from.
Okay,
that's not addressing donors from outside of California.
Okay, and how many donors total that you in your current state of?
I don't have the exact number of donors from across the U.S.
Are they? What? Roughly, is California in proportion to other states, or do you have more donors outside of California in general?
It's not equal across all the states. There are definitely certain states that have more donors. California is not the largest state.
Which do you mind just maybe what's the top 2 or 3 states that you're particularly?
Senator, I don't have that information in front of me at this time.
Okay. All right, but certainly there is a possibility that you know, and I assume that the demand for your product is it doing well?
Yes, sir, it is.
I mean, it sounds like a good product. It's not so. And so I expect that you're hoping to actually expand production and get more donors, correct?
That's correct. We'd like to see all preterm infants born less than 1,250 grams to be able to have access to a 100% human milk diet.
Okay, all right. So the 226 is what you currently have now, but actually you'd hope that grow, actually, well, and at least total, right?
Yes.
Okay.
Yes.
All right. And then the other question I have is that in regards to in regards to the bill, because I keep hearing things like total ban, but just to be clear, this bill, from my understanding, does not prohibit donation of giving breast. Someone could actually come to Prolect and say, here's 300 ounces of breast milk I want to give. Under 6 months of age, 6 months of age of the baby, the first 90 days, and you could still take it, correct? Or in fact, you could even solicit for no compensation up to until, I mean, realize it's a different, it's maybe harder, but is there a prohibition against someone donating milk to you or giving milk to you without compensation up to that point in time?
Well, Senator, that's our reading of the bill because it defines, it seems to define us as a human milk tissue bank, a separate entity, and that entity is prohibited from procuring milk from a donor less than 90 days postpartum if they remunerate donors.
Right.
So
I mean, it's a remuneration, but you can still accept it without, if someone says, I want to give it to Prolect It because you're doing such great things with breast milk and you're going to save premature infants, you can still take it, right? As long as you don't remunerate, according to this bill. Is there any prohibition from you actually accepting the breast milk?
well, our understanding is if we remunerate a set of donors,
No,
then
I
that
said
makes,
don't remunerate. That's what I'm
we
saying.
remunerated no donors at all.
No, hold on. I want to clarify this because it's a very important point.
Yes.
So woman decides they want to donate breast milk to you because you're doing wonderful things with the breast milk.
Yes.
And their baby is, however, 4 months old, before 90 days, right? Or 30 months, actually. It used to be the 100. Then you could still accept that. Whether you choose to do so or not is another issue. But you could still accept that without, you do not have to as long as you don't pay remuneration, correct?
That was what they were doing, the company, until 2011. They changed the policy.
Okay, so you could still actually, you could actually have an arrangement with a mom under this bill, if passed into law, that if a woman said, all right, you know what, I have excess breast milk, I'm going to donate it to you. I think you're great people, I love you. And then you can start paying me after my kid's now 3 months, 90 days old. But you could still actually take it before then for no remuneration, correct?
Senator, I'm not sure that that's our understanding of how it's written. Our understanding is that if we remunerate
Okay, let me ask the author then, since
Okay.
he's the author of the bill. So can Prolacta or any other company actually accept breast milk without remuneration until 90 days after the birth of the
Correct.
child?
Yes.
Okay, so it's not a prohibition. It is a prohibition against remuneration, not a prohibition
Correct.
against,
For the first 90 days.
right. It's a prohibition against remuneration, not,
Right.
but, okay.
Correct.
All right, I just want to clarify because I just don't want to confuse that.
And that's the heart of the bill.
Okay, that's the heart of the bill. Okay, and then the other question is, and I know that the good doctor said that it is the AAP's recommendation, because I understand planning to take an amendment, however, that we should encourage women to exclusively breastfeed until 180 days, correct? I am a member of the AAP, so I guess I can answer my own question, but I just want to confirm that we all agree on that, right?
That is the recommendation.
That is the recommendation. That's kind of that's the recommendation most people, it's been professionally recommended. Okay, that's important too. Okay, so we're actually, and then I guess the other question is that, and actually I know Wick was here. So if there's a low-income woman who's on WIC, would she be able to get formula for free?
Here she comes.
Okay. Hi. So what would happen if someone said, I'm going to sell my breast milk and then I want formula from WIC?
I'm from the California WIC Association. Right now, I think the policy is that there's no formula provided in the first month.
Okay.
To incentivize women, incentivize is a bad word in light of what we're discussing, but to sort of promote breastfeeding in that first month when the milk supply is established. And after that, if a woman chooses not to breastfeed or can't breastfeed for whatever reason and can't get donor milk, then yeah, WIC would provide formula.
Okay, what if a woman said, I will take formula because
I don't know if it's ever been, like, in a WIC office, if a woman was talking to her lactation consultant and said, I want formula because I would like to sell my breast milk, I can't imagine WIC would respond positively to that. I don't know that it's ever been asked, and I don't think even if a woman were going to do that, that she would necessarily advertise
may not
that
necessarily tell
to
you.
WIC.
Right, I mean, probably wouldn't, but you never, people say the interesting things sometimes, so, okay, all right. Okay, well, I think we're trying to strike a balance here, because, we want to give people the latitude, of course, it's their, and autonomy to decide what's best for their own circumstances, right? I mean, I think it's very important. We also know that, unfortunately, if people had true autonomy, it would be because we did a much better job in providing them childcare, housing, a lot of other things that we haven't been very good about. I do share a concern of my fellow pediatricians from the American Academy of Pediatrics, of which I'm a member, in terms of not creating, and that goes back to other issues with other forms of donations too, where you don't have a situation where we're actually creating a bind, really, because I don't think the mom's sitting there going, well, I don't want to breastfeed my baby, but they're trying to figure out how to juggle maybe a very difficult financial situation, and that we have incentives. And obviously, we need to do a better job in helping support those women and those families. I mean, that's in many ways that failure is ours. But I am concerned, and share the concern of my fellow pediatricians, about creating incentives where we would actually, well, let's put it, we'd be discouraging breastfeeding, we'd be encouraging lactation, but not necessarily encouraging breastfeeding. And again, Prolact is maybe currently the main company and is doing a good thing, and you're doing a good product for helping babies who are vulnerable. But we were talking about how to make policy that works, that isn't going to create incentives overall for other players as well who may enter and who may decide to then engage in the market. So I hope certainly we can keep up the dialogue, but I do think the bill does try to strike an appropriate balance.
Okay, Senator Roth, I believe, had a question or comment.
No, just a question, quick question, Mr. Chair, thank you. What percentage of your paid donors fall within the 0 to 90 group?
The 0 to 90, I don't know that exact number. When we looked originally at the 0 to 180, then that was about 50% of the milk was within that 6-month period.